Dialogues. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Why high sugar diets can worsen IBD. Excess sugar hampers cells that renew the colon's lining in a mouse model of IBD or inflammatory bowel disease, according to a new study by University of Pittsburgh scientists. Led by Anson Burr, who's a PhD, the researchers started by feeding mice either a standard or high sugar diet. They then mimicked symptoms of IBD by treating the animals with a chemical called DSS that causes damage to the colon. To their shock, all the mice on the high sugar diet died within 9 days. In contrast, all the animals on the standard diet survived until the end of the 14-day experiment. Hydrocortisone may improve treatment of septic shock. In a recent study published in the New England Journal of Medicine Evidence, an international team of researchers studied the role of hydrocortisone in the management of adult patients with septic shock. They found that while the effect of hydrocortisone was modest in terms of overall survival, it was associated with a decrease in the need for vasopressor drugs and improvement in survival when used in combination with other corticosteroids. The research team performed a meta-analysis of the effect of hydrocortisone on patients with septic shock by pooling individual data from studies conducted between 1998 and 2019, including adult patients with sepsis or septic shock who received intravenous hydrocortisone at a maximum daily dose of 400 mg for at least 72 hours, or a placebo. Individual patient data were available for 17 studies, and 7 of these provided the 90-day mortality data. GPR 141 regulates breast cancer progression via oncogenic mediators. An inherent property of cancer cells is enhanced cell proliferation rate and migration capability, leading to deregulated cell signaling cascades. G-protein coupled receptors or GPCRs have recently emerged as a hotspot target in cancer research. Researchers from the Institute of Life Sciences Regional Center for Biotechnology and All India Institute of Medical Sciences identified aberrant expression of GPCRs 141 in different breast cancer subtypes that correlate with poor prognosis. However, the molecular mechanism via which GPR 141 advances breast cancer remains elusive. Increased GPR 141 expression enhances the migratory behavior of breast cancer, driving oncogenic pathways both in vitro and in vivo through activation of epithelial to mesenchymal transition, oncogenic mediators, and regulation of pMTOR or p53 signaling. Promising skin patch for toddlers with peanut allergy. A global phase 3 clinical trial found that a year-long immunotherapy through a skin patch safely desensitized toddlers with peanut allergy, lowering the risk of a severe allergic reaction from accidental exposure. Results of this randomized double-blind placebo-controlled trial for children 1 to 3 years of age were published in the New England Journal of Medicine. We were excited to contribute to this landmark study that carries so much promise for our young patients with peanut allergy, said co-author Melanie Makija, who was the principal investigator of the study at Lurie Children's. She added, children who originally reacted to a small fraction of a peanut were able to tolerate the equivalent of 1 to 4 peanuts after completing the treatment course. This means that these children will be well protected from accidental exposure to peanuts. Importantly, we found that the peanut patch was safe with very low chances of a severe allergic reaction. This is terrific news for families of kids with peanut allergies. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.